An absolute pleasure to welcome Andrew Herr to the Venari Podcast. Andrew is CEO and founder of Fount, an incredible data-driven and fully customizable health performance service and application. We'll dive into Fount and some of their newer products a little bit later. But Andrew, kind of welcome to the podcast.
Great to be here. Thanks, Christian. Really looking forward to chatting today.
I want to start right at the beginning and, tell me a little bit more about, your upbringing, your childhood. Were you always destined to do something in healthcare, do you think?
If you look at my background, it probably wasn't unlikely. So my dad's a doctor. If I lived my life 10 times, I figure I've been a doctor 5 of them, and the other 5 probably doing what I do today. Mom's side of the family has a really rich military history. And so, the way I got to this human performance field was ended up finding a program where I could do science, technology, and national security. Went to graduate school and did more work in immunology and health physics, and then got a phone call one day from the Career Center, and they said, "Hey, Andrew, somebody came in. They said they need someone who does biology, national security, and can write." And they're like, "Well, we know this guy, Andrew." And I got hired to run a studies program on the future of human enhancement for the Secretary of Defense's kind of private think tank in the U.S. military.
That's fantastic. I mean, how did you end up in such a cool job, leading, human performance basically for the US military?
I mean, really, serendipity and interests combined. So I had quite a unique academic background. I had, master's degrees in 3 different subjects that sort of circled the topic. Was in DC, which, the city you're in can matter. And then, really that phone call opened it up. And then, I really went deep on those topics, had the opportunity to go deep on what the physiology is that drives elite unit performance under high stress. So like, how do you lead teams under high stress in combat? And how does the leader's behavior change the physiology of the subordinates? What are opportunities to enhance our soldiers, sailors, airmen, Marines, warfighters in the future? What are, potential threats to us? So got to touch so many different topics that set me up to work on everything from research and development strategy to run a big clinical trial to getting people ready to deploy, and having opportunities to think from strategy down to really the bleeding edge application, I think was critical for me to be able to think about where to go from there and how to build Fount in a way that we could help a lot of people.
Such a cool job. Like wondering, I suppose how and why, what made you leave the military and start your own company?
I think during that time, I loved the mission. I loved a lot of the people I was working with, but bureaucracies are slow to change. And so certainly in small pockets, in certain special ops pockets, things were moving ahead really quickly. And that was amazing. And we got, some other areas, got some wins I really cared about. But throughout that time, I really had this question, which was, how do we go from helping 1,000 special operators to hundreds of thousands of Army grunts? And that question, how do we scale this? How do we help a lot more people, is really what pulled me towards, eventually starting Fount, which was, look, we know how to work with the C-suite or elite special operators, bring in elite coaches, build a facility, but those are too expensive to do at scale for people, on the factory floor. And so, what I realized at Fount was the way to help anyone properly is to do N of 1 experimentation. I don't care what the average of some clinical trial says. I want to know if something works for you. And so what we do is, we run these experimentation-based protocols. We, track your data, could be blood work, wearable data, how you feel, whatever, depends on what your outcome you're looking for is, and see if it works for you. And then that tells us where to go next. And so what we realized is if we could do that for enough individuals, we would have this very unique data set that told us tons about the individual from all the data we have, tell us what works for them. We could say, hey, if this intervention worked for this person, did these 5, 10, 20 others work for them? And that data set would allow us to build AI models that could then scale this to millions of people, because we could build an elite digital coach. And so understanding a path to helping millions or tens or hundreds of millions of people, as opposed to just the elite of the elite, that's what really pulled me towards the opportunity and really, frankly, the mission to build Fount.
Where do you see Fount in, say the next 5 years?
So right now we run a high-end coaching service.
Yeah.
It both delivers incredible experiences for executives and entrepreneurs, really anybody, but it's expensive. It costs $1,500 a month for 6 months subscription, and we can deliver an incredible amount during that time. And that data is already now powering the very early versions of what we call Fount AI, which will be a digital coach that can do N of 1 experimentation with you, but without having to pay for an elite human coach. There will always be an amazing value to having a human coach there, but this ability to do this for more people is coming faster than I ever thought. The AI, revolution is helping us do it faster. And also just we've learned so much about how to run these programs from our coaching service that we're going to launch the beta version of this by the end of the summer. And before the end of the year, we will have Fount AI on the market alongside the products we've already launched that, we used to only have to be one of our clients to get access to our jet lag stuff. And now we can, buy a product that costs less than $100 for a round trip. You can fly anywhere in the world with no jet lag. We'll be launching a product that eliminates PMS for 80-90% of women, immunity, fertility, hangovers. Like, we're going to be launching a series of these products that make these insights and these technology available. And then obviously culminating in this coach that can help you sort of figure out nearly any challenge: energy, focus, mood, sleep, gut health, all these like major things in people's lives.
Kind of given your experience in founding a company, like, would you have, any advice for future founders looking to start their own kind of healthcare company, and any of the challenges and pitfalls that you've seen like up to now, and what advice you can give?
I think it depends what part of healthcare you want to go after.
Yeah.
If you want to go after traditional healthcare paid for by insurance, whether in the US, health insurance, or NHS, or abroad, or in the UK, you've really got to understand the dynamics of who pays for things and what their incentives are. A lot of people think that, oh, I can give this app to a pediatrician and it'll make, it'll help them make a better decision. But if that app gets in the way of seeing more patients, it often is just a burden and it doesn't end up working out. You need to understand, how is somebody getting paid to use this, or how, and all those dynamics. And in the wellness space, like, I have a strong bias. I have a pretty deep technical background, and I find there's a lot of people who come into the space, they made changes that worked for them, phenomenal. But then they assume that those same changes will work for everyone else. And I don't have a problem with people offering it, because, it will help some people, but I think moving beyond one size fits all is really where we need to go to help more people, and to do this in the right scientific way. And so, my recommendation for anyone out there listening, whether you're going to start a company or whether you're a user of these products or this technology, is like, run it based on experimentation. If it doesn't work, if you don't feel a difference, you don't see a difference on your labs or your wearable data, it's okay that it works for other people and not for you. Run everything based on experiments. And so I think that's the way I think about it. And look, there's just a lot of kind of BS-y stuff out there in the wellness space. So just test it. And some of the stuff that seems like BS is real, and some of the stuff that seems real is not. And so test it and just see if it works for you.
Fantastic advice. And I really appreciate you, joining us, Andrew, and sharing the insight. And, it's fantastic what you guys are doing at Fount. And, I can't wait to, basically watch your space, really.
Yeah, I think, look, there's a huge amount of innovation in the health space, a lot of it outside the traditional system. And I think that's exactly what needs to happen.
Yeah.
If I had believed staying in the system was the right approach, I'd still be trying to work with the Pentagon right now. And I would still do some work with military, but obviously I'm quite focused on the private sector. And I think it's the right way. We need to build a new system around the current one, which is ossified and not serving people.
Yeah, no, 100%. And, thanks again, Andrew, for your insight. It's been an absolute pleasure to have you join us.
Thanks, Christian. Fantastic to be here, and look forward to continuing the conversation with you and others.